itchy, scratchy, scaly, and miserable. Eczema. Let's talk. Welcome back to Pocketbook Pediatrics. I'm Dr. Rishalan Brown, and as usual, I'm always so happy to have you here with me today. So, itchy, scratchy, scaly, and just not nice eczema. That's what we're going to be talking about today, and it is a common problem that we face with our kids, and sometimes it can follow them into adulthood, so it's important to talk about. Now, remember we spoke about cough. We said all cough is not cold. I think it's important to say for rash as well, all rash is not eczema. Because oftentimes I find moms and dads, they come into the office and they say, baby has eczema. And when you check it out, it really isn't eczema. So it's important to have doctor diagnosed eczema so that you know you're getting the right treatment, and we can also tell you the right prognosis for this disease and sometimes others as well. So what is eczema really? Or your doctor may say atopic dermatitis. Atopic meaning related to some type of allergic reaction, and dermatitis meaning an inflammation of the skin. So eczema is an allergic type of reaction that causes some inflammation of the skin. So who gets eczema? Good question. Well, 1 in 5 kids will actually have eczema at some point in their lifetime. And we find that these kids, they tend to have some other type of allergic disease like asthma or allergic rhinitis, which is what we generally call allergies, meaning the runny nose, the itchy nose, red eyes, watery eyes. And we also find that their parents or their siblings may also have this disease or have had these illnesses in their lifetime. So the next question you may ask is, well, Dr. Brown, I have asthma and now my kid has a rash. How do I know if this rash is eczema? And that is a very good question. So how do we diagnose what rashes are? We really take a look at what the rash looks like and how it's distributed across your body. Now with eczema, this is going to change as your child ages and also with the length of time that the rash is present. So as an infant, we find that eczema tends to involve the face, usually the cheeks, forehead, sometimes the scalp, and it's the back of the elbows and the front of the knees that are most affected. When your child gets a little bit older in those childhood years, this changes to the flip around. So we're having the involvement of the creases, so the front of the elbow and the back of the knees. And as they get into the teenage years and sometimes the adult years, we find that the neck and the hands and the feet may become involved as well. Now we also look at how the rash looks. So if it's acute, which we said before is something that is lasting for a short time, we find the rash tends to be small bumps with some redness. And that varies depending on your complexion, because if you're darker, that red can actually begin to look a little purple more than red. And there's some flakiness or some scaliness around the rash. But when it's been going on for some time, we find that the longer that the inflammation is there, it can cause some thickening of the skin. And that redness actually changes now to a hyperpigmentation or a darkening of the skin, or sometimes the opposite, a hypopigmentation or a lightening of the skin. And then there's just a heavier amount of that scaling that is present. And it, as I said, is also very itchy, so it's not comfortable, and it can be distressing for the parent to be looking at the child being uncomfortable, and for the child with all the scratching that comes with that itchiness. So how do we go on to further diagnosis? Well, there are no lab investigations for eczema. It is an office diagnosis, so it's based on what we see. Now, if it's very severe, your doctor may begin to think, is there something else going on, and another illness like psoriasis, and maybe a skin biopsy may be done. So that's a small piece of the skin is taken and they look at it under a microscope. Or if there is a lot of scratching and some breakage of the skin, sometimes there are infections on top of the inflammation that's there. And if it's a bad infection, your doctor may want to do what is called a culture test or a swab to make sure that they're treating the bacteria with the right antibiotics. But this is rarely done. For most cases of eczema, it's just what is seen in the office that is necessary to make an accurate diagnosis, and treatment can be planned. So that's the next question I'm going to ask now: how are we going to make it better? Because that's really what we want to do, get the skin to be good and in a healthy state. And eczema is treated with topical medications mostly. So a topical steroid like hydrocortisone ointment is appropriate for use. And then we also want to use creams and lotions that are going to help keep the skin very well hydrated, very moist, and keep that flakiness down. It's also important to say that eczema happens in flares, so it comes and it goes throughout the course of your child's lifetime. So good skincare is going to be important throughout the course of their life. So you want to use gentle soaps for bathing and those gentle creams and lotions. So gentle meaning that we don't want it to have any fragrance or any dye, because those things tend to help bring out a flare-up of the eczema. And we also want to make sure that we have good nail care, because with all of that scratching, we want to make sure the nails are clean. There's no additional reason to, bring on an infection on top of the inflammation that's there. So nice, well-trimmed nails that are clean are going to help keep those eczema flares under control. And there is good news on the horizon. At least 50% of kids, they outgrow their eczema by the time they're 5 years old. So that's a very good news for us. So that's all for Pocketbook Pediatrics today. And I hope that the next time that your child has a rash, you'll really be able to talk to your pediatrician and you'll be able to see if eczema care really is the right treatment for you. Thank you so much for watching. I always look forward to having you with me. I look forward to seeing you the next time on Pocketbook Pediatrics. God bless.